Hello, thank you for joining me on Power to Heal. I am Dr. Jeffrey Brown. Now, September is Ovarian Cancer Awareness Month. So, today I want to talk about endometriosis because you are twice as likely, almost twice as likely, to get ovarian cancer having endometriosis compared to those who do not. So, we are going to talk about that. Now, unfortunately, women's health in this country, I hate to say it, basically sucks, right? What are your options? Birth control, antidepressants, and surgery. So that doesn't leave you a whole lot of options when it comes to helping with women with hormone imbalances. So that's what I want to talk to you about today is that you do have options. I want you to know that. There are holistic, comprehensive approaches that can help to eliminate that fear that you have every single month. For those who suffer from endometriosis, you know what I'm talking about. That month, that 2 weeks during the month or even longer where you just dread. So we're going to talk about that. All right, so endometriosis affects about 10% of women of reproductive age. It's a pro-inflammatory condition that can lead to infertility. In fact, half of women with infertility suffer from endometriosis. Now, endometriosis is a condition where the tissue that lines the uterus grows outside of the uterus. It can grow on the ovaries, fallopian tubes, intestines, and other areas lining the pelvis or the abdominal organs. It can even be in atypical places like surrounding the sciatic nerve or even around the eyes. I know, very strange, right? Now, pain is the most common symptom associated with endometriosis. Very painful menstrual cramps, lower back pain, pelvic pain, having a lot of pain during sex. And even with bowel movements or urination, you can have pain during this time. Now, endometriosis is also associated with heavy and or irregular periods, bloating, constipation, nausea, fainting, and even chronic fatigue. So if you suffer from any of these symptoms that I mentioned, and they're very debilitating symptoms they can be, you may have endometriosis. Now, endometriosis is a very complex and it's associated with a variety of conditions and diseases. All right, and there are three components that I believe that are important to address when dealing with endometriosis. And so today is part one of three of a series that I'm going to speak about with endometriosis with these videos. So first I want to speak about its association with Candida overgrowth. Now, there's evidence to suggest that Candida albicans may contribute to the pathogenesis of endometriosis. A high incidence of infection with Candida albicans has been reported in women with endometriosis. Candida albicans normally lives harmlessly in the gastrointestinal and genital urinary areas of the body. But when our immunity, our immune system, and our resistance, they become low, and the intestinal ecosystem becomes imbalanced, the candida, also known as yeast, multiplies way too rapidly and can wreak havoc on our bodies. So if you suffer from any of the following symptoms, you may have candida overgrowth. Now, the first is fatigue, feeling tired or weak, skin disorders like eczema, hives, itching, chronic sinus congestion, seasonal allergies, brain fog, difficulty focusing, concentrating, frequent bladder or vaginal infections, vaginal or rectal itching, digestive issues like gas, bloating, constipation, diarrhea, abdominal pain, right? These are also associated with people who have IBS. So just think about that. People who have strong sugar and carb cravings, you may have a white, coatish tongue, all right? Skin or toenail fungus, and joint pain is also common, all right? So if you have any of those symptoms, it's possible that you do have candida overgrowth. So how do I test for it? Well, first, I like to order a candida antibody test in the blood, IgA, IgG, and IgM. Now, if any of those are elevated, then I'm going to treat as if you have it, all right? Now, I do know that most patients are never treated for candida by conventional doctors. Sometimes they just don't believe in that. But if you're suffering from those symptoms, I definitely believe that you should be treated for it, and you may see some great results. All right. So what increases your risk for candida overgrowth? You're probably asking. Well, first is having a past or current uses of antibiotics. You may have had chronic ear infections, sinus infections, but taking all those antibiotics, it destroys our gut flora and makes it more possible for candida to take over. High stress. Who doesn't have stress, right? That chronic stress definitely leads to weakened immune system in promoting Candida overgrowth. Drinking too much alcohol, that is also there. Excessive intake of sugary beverages, all right? Too much sugar in this country, so we got to get rid of that. Now, also hormonal imbalances caused by birth control. That's a big one. Birth control leads to Candida overgrowth. Steroids, the Medrol dose pack of chronic steroids for those who may be, treating an autoimmune disorder or asthma or something along those lines. Okay, so those are common causes of Candida overgrowth. So let's talk about treating Candida overgrowth and restoring our gut health. So the most important thing when treating gut health is to address the gut flora, is our diet, right? Focus on eating whole foods that are not anti-inflammatory and avoid inflammatory foods, right? Dairy is a big one. Gluten, everybody's heard about staying gluten-free. Well, because it's inflammatory. Sugar, we just spoke about that. High fructose corn syrup, sucralose, any soft drinks and those artificial sweeteners can do it too. Corn can be inflammatory. Beef and processed meats, eggs, peanuts, shellfish, and I'll mention again, alcohol. All right, the next thing you need to do is incorporate stress-reducing activities during the day. Now, exercise doesn't count because that's still in that fight or flight mode. We need to do things that are more calming and restful. Okay, so it's very important. And I recommend that we do it 3 times a day. First thing in the morning, sometime in the afternoon, and later on in the evening. Spend time in gratitude, meditation, getting a massage, watching some funny videos, or comedy, going for a walk, hitting the sauna, jacuzzi, take a nice bath, listen to music. You get the point. Just find things that's going to help you to relax, get out of that stressful mode, that fight or flight, and get into what we call rest and digest. All right. Now, also, for those of you who like to, work and eat, don't do that. Sit down, relax, enjoy yourself. Eating is a parasympathetic activity. You shouldn't be trying to combine that with work. That's not the time for that. All right. Just watch something pleasurable, spend time with your coworkers, or go sit in your car, but get away from work while you're also eating at lunchtime. All right. Now that you have reduced the impact of stress on our bodies, and you've eliminated or significantly reduced the foods that are feeding yeast, we're going to discuss some natural treatments that you can use to stop the overgrowth of Candida. Probiotics are important to restore the balance of the microbiome. All right, berberine, grapefruit seed extract, and garlic. These are herbs that are known to have been successful in treating Candida overgrowth. Now, sometimes you may even have to use prescription antifungal medications. I prefer the more natural route, but there are occasions sometimes when using medications, are necessary. Now, the next test I'm going to order for patients is a GI map test or some type of comprehensive stool analysis. All right, there's increasing evidence that support the role of the gut microbiome in the formation and progression of endometriosis, through inflammatory pathways. So, in other words, the imbalance of our gut health affects and influences, our hormones. In healthy adults, the gut microbiome is dominated by members of the Bacteroides and Firmicutes species. However, in disease states, the microbiome will shift to represent a larger percentage of other bacterial species. And so the stool analysis is very comprehensive. It's going to show us what the percentage of all the bacteria species are. And so this is very important in restoring balance to our gut microbiome. All right. The GI map also shows opportunistic and pathogenic bacteria, as well as inflammatory and autoimmune related bacteria. The GI map or comprehensive stool analysis also will show how estrogen is metabolized. Estrogen metabolism is influenced by the estrobolome, okay, which is a specific community within the gut microbiome that affects estrogen. They secrete a specific enzyme called the beta-glucuronidase, which influences how the estrogen is being metabolized or excreted in the body. All right, endometriosis is an estrogen-dominant condition, and altered estrogen metabolism is seen with altered gut microbiome. So it's important that we know that. And the GI map measures this beta-glucuronidase, as well as other enzymes indicating, gut health, in addition to other inflammatory markers and intestinal barrier health. Now, the scientific community is discovering more and more each day how our gut microbiome impacts our overall health. It impacts our immune system, our weight, our heart health, our mental health, hormones, and so much more. So every woman suffering from endometriosis or any hormonal imbalance really should have a comprehensive stool analysis or a GI map. They should have that run. But unfortunately, it's not part of our standard medical practice. So you need to find a practitioner who's experienced in running this test and knows how to treat it. So remember, you have the power to heal. I want to thank you for watching this video. If you liked it, please like us. Share this with your friends and family. Subscribe to our channel and stay tuned for part 2 of our series on endometriosis. Thank you for watching.